Hello, I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our weekly Facebook update. For Thursday, September 3rd, the TriCounty area of Peoria, Tazewell, and Woodford are reporting 3,925 cases to date. This is an increase of 369 cases over the past week. Peoria sits at 2,480 cases, Tazewell County at 1,150, and Woodford County at 295. We are sad to report a new death within the Tri-County region to a female in her 80s from Tazewell County, not associated to a long-term care facility. Overall, that puts an increase of 3 new deaths reported this past week between the Tri-County, 1 for Peoria and 2 additional deaths in Tazewell County. Overall, 3/4 of our cases are considered recovered. And right now we're averaging in the Tri-County 53 new cases each day, and specifically in Peoria, we're averaging 30 new cases each day. This is a decrease from previous weeks. Overall, 22.3% are at home and isolating, and 1.4% are hospitalized. In terms of our hospital data, right now we have 16 individuals in the ICU, and those are all confirmed with COVID-19. And we have 35 individuals in non-ICU beds related to either under investigation or COVID positive. In terms of our hospital systems, we're averaging 17 ICU beds in use each day related to COVID, and 59 total beds being utilized throughout the hospital systems here in Peoria. And that includes OSF St. Francis Medical Center, UniPoint Health, Proctor, Methodist, and Pekin. When we think about this data and the news that we're seeing, one of the key things to understand is what we're about to head into, always planning and looking ahead. We noticed that about 4 weeks or 2 incubation cycles past the reopening of phase 4, along with 4th of July weekend, that our community saw a huge spike in cases. And that was because of individuals gathering together or traveling around that 4th of July weekend and the subsequent cases that came from it. We're about to go into another long weekend with Labor Day, and we really want to focus on the fact that all the good work our community has been doing, embracing face coverings and masking, our schools reopening, the social distancing and hygiene practices that we're all putting into place, let's keep growing with that. And keep in mind that if we decide to travel over this long weekend, continue to do those precautions. Even if you're visiting a state or a community that doesn't necessarily follow that, those are great considerations so that when you return, you're bringing memories back with you into our area, not necessarily the virus. Likewise, September also marks our National Preparedness Month, and maybe this year more than ever, we really kind of understand what it means to be prepared, whether we're addressing a pandemic or what we commonly do, which is our responses to natural disasters. So during this time period, we always like to remind people of 3 basic steps. Get a kit, make a plan, and be informed. And this can cover a variety of topics. Get a kit. Make sure you have enough emergency supplies on hand, including non-perishable foods, first aid kits, any prescription or flashlights. Make a plan. Talk about what your family will do in response to an emergency, whether it's a natural disaster or whether it's a pandemic or if someone falling ill in your family. How do you communicate? How do you make sure that they're going to be able to get those resources? And be informed. Information is important. It helps us understand the risks that we're about to take, as well as making sure we can protect ourselves. So visiting websites like the Peoria City County Health Department website or the CDC or even our FEMA websites all have great information about how to be informed before and after a disaster. Lastly, in the news, we've seen a lot of excitement around getting ready for a vaccine campaign related to COVID-19, whether it's states preparing to understand how they would ship it, the process involved. All of this is, giving us really a lot of hope in terms of what's coming in the months to come here, both here locally and nationally. But before we even talk about the COVID-19 vaccine, there is a vaccine that's already in our community and very important, and that's the influenza vaccine. Anyone 6 months and older that is able to should really look at getting this vaccine for a variety of reasons. First and foremost, it does not give you flu. This is a common misconception. In fact, the flu vaccine has the ability to either drastically reduce or give you no symptoms as related to influenza. Likewise, by getting the flu vaccine as a community, what we're doing is we're protecting some of our primary resources in our healthcare capacity, because individuals without severe cases won't be necessarily needing those ICU beds or that medical surge capacity. So again, the flu vaccine not only protects you, it protects those around you, especially those that can't get the flu vaccine, and it helps us as we gear into the fall, really protect our healthcare system and our public health infrastructure. So as we are excited about COVID-19 vaccine, don't forget influenza season and influenza vaccine, and it's already here in our community. With that, again, just want to make sure everyone stays healthy and safe, and we'll talk to you next week.